Hi, today's question is about sleep disorders and speech and language delays. So as you know, my name is Jules. I'm a speech pathologist of 16 years. With some children with speech and language delay, it can correlate to also have a sleep difficulty, and which needs further investigation. So it's always really important to look out for these key signs in your child. If they're frequently waking, if they're snoring or appear to have obstructions, or if you hear them choking or coughing during the night, if they're appearing very tired, dysregulated, falling asleep at different times throughout the day, it could be an indication that there is some sleep disturbances going on. One thing you can do to help that is to have a sleep study. All you need to do is chat to your doctor, your GP, and ask for a referral for a sleep study. Part of that will be covered by Medicare, and depending on if you have private health insurance for the hospital, as it will be an overnight stay. It's a pretty straightforward procedure. A lot of children have had them. Our children have had them, and it's not painful. And what happens is the sleep specialist is able to determine how many wakings there are during the night and how many movements and the oxygen levels of sleep throughout the night. So the key indicators that they're looking for are obstructions. So this could be tonsils or adenoids, things around the pharyngeal wall or the nose that are interrupting that airflow. Okay, they're going to be listening for audible breathing, which is also known as snoring, and they're going to be looking at movement, so like leg twitches and things like restless leg syndrome, how active the child is before they go to sleep or during that sleep, and how often they're waking up. So it is a very clinical study. It's again, the child will be asleep despite having being in a hospital bed and having some things attached to them. You'd be surprised. This can range for children of different ages, as young as 2. It really is important to get looked into because the findings can help support some changes that will also support speech and language development. Another thing that could be picked up or may require further assessment may be silent reflux. So where a child may not present with typical reflux symptoms, but may have digestive juices or food coming up through their esophagus, touching the vocal folds, which causes them to close automatically. The child's not aware of this, they're asleep, but it does stop the breathing, okay? And desaturation and oxygen levels can go quite low. So that's something to be aware of. Reflux is treatable, and when it's silent, it's very hard to determine. So for anyone who's, as a parent feeling like there is something wrong with their child's sleep patterns or that they are having some issues there, I would definitely encourage you to talk to your doctor about it, look into some options for a sleep study and get some answers there. So I hope you found that helpful. If you do have any other questions, give me a question and I'll answer it.